Good morning, everyone. We're going to get back into some more lectures about the next type of impression material called polyvinyl siloxane. And again, I'm going to just be using the outline that is in your module, and it is just a continuation of the one we used yesterday. So polyvinyl siloxane impression material, otherwise known as additional condensation impression material. This has many different names, one of which is Extrude, another is Express. There's Reprosil, President, Aristocrat, all different types of polyvinyl siloxane. Another abbreviation for this type of material is PVS. And when Annette was at the campus for CEREC demonstration, she talked about during the demo about having PVS versus the digital impressions, and this is the type of impression material that she was referring to. Uses for PVS or polyvinyl siloxane is going to be dentures, partials, crowns, bridges, and inlays. So pretty much anything that would be sent to a laboratory to be fabricated can be done with PVS or polyvinyl siloxane. It's a very popular, very user-friendly, very great product. It is median priced, has great results, and it's a nice material to use. When I was working chairside, I did a lot of work with the Reprosil brand of material. We used it for the entire time I worked with the doctor that I worked with for nearly 16 years, and we had wonderful results with that material. Loved using PVS. So this material can be supplied in many different fashions as well. It can be a two-paste system where it comes in the tubes. You dispense equal portions of the material in a paper pad and you mix them. It can be formulated in a light, medium, or heavy body viscosity. The composition of the material, as it states, the base is a silicone formulation, has polymers inside of that, and then there is also reinforcing fillers such as silica, which provides consistency to the material. The catalyst has vinyl silicone monomer in its composition, and this forms a primary reactant to cause the materials to set and be able to be removed from the oral cavity. The catalyst then, of course, initiates and accelerates the set of the material. It also has a reinforcing filler of silica, which again helps with consistency and stiffness of the product. So depending on what type of viscosity is being utilized is going to be determined by how much of that reinforcing filler is available. And then there's also chloroplatinic acid in the material as well. The inhibition of the set can be from rubber gloves. So another reason why latex is kind of being phased out of dentistry is because when people are using this type of material, the latex and the powders associated with the latex will interfere with the set of this material. If you're doing an anterior impression, for example, and you have your finger on the tooth as a fulcrum, that latex glove will leave an imprint on the tooth and the material will not set around that area where the latex was in contact. So that's kind of annoying. Rubber dam also can have an effect on this for the exact same reason. In vinyl gloves, even though they're not made of latex, they have the same powder that helps the operator put them on and take them off. So that powder is what actually is going to interfere if you're using vinyl gloves. The nitrile gloves that we have in our clinic do not have any powder, and that's why they are safe and effective to use with this type of material. PVS, polyvinyl siloxane, is very sensitive to contamination to other chemicals. You should not use the same spatula to mix this material that you would for addition silicone, especially like polysulfide, because it will again interfere with the set of this product. It can be in a potty wash system. So remember when we did the silicone with the green, really thin material that was put in the little cup, and then the pink little spaghetti that you had to dispense. the white part of it was the putty that you did the initial impression with, and then the green was the wash impression. So this polyvinyl siloxane can also be in a system such as that. It can also be provided in auto mix cartridges, where there are mixing guns with mixing tips and syringe tips that are special for each of those guns and each of those types of materials. Some have equal size cartridges, some have a larger base and a smaller catalyst cartridge, so depending on the type of and brand of polyvinyl siloxane will determine that look for those cartridges. When you use an auto mix cartridge, it results in a mix with fewer bubbles than hand spatulated mixes. It also is going to quicken the process of mixing it, so it extends your working time for this type of material. And it can also be placed in the mechanical mixer. So those Pentamixes again, or a special separate mixer for the polyvinyl siloxane can also be utilized for this material as well. Properties for polyvinyl siloxane. For dimensional stability, the textbooks say that this has the very best stability of any of the materials. It has the lowest deformation of all of the ones that we have talked about thus far. So it's a great product. It has excellent reproduction. So if we're taking a really detailed impression for an inlay, for example, this material is fantastic because it does have such great reproducibility. Has very great accuracy, superior accuracy. It's easy to mix. It's much easier to mix than polysulfide. It has no staining or odor. And if you were able to ever smell the permadyne from the polyether that we talked about earlier, this material has no flavor, no odor, so it is a much better product in my opinion. It is hydrophobic though. So it is poorly wetted by water with a contact angle that is very steep, such as 90 degrees, which can create air bubbles when it is poured with a gypsum product. So the manufacturers can add a wetting agent, or the laboratory can also spray it with something like the debubblizer that we used in lab class to eliminate those air bubbles from forming. It causes less tissue irritation than condensation silicones and the polyether that we talked about earlier. The stiffness of this material makes tray removal difficult. So it is firm, it is rigid, and it does take a little bit of art to get this material out of the oral cavity, but it is able to be removed, and most times it does not create an issue. Pouring of the models can be delayed up to 7 to 10 days from the initial removal from the oral cavity. However, the manufacturers of nearly all of these materials state that we have to wait at least 4 hours to pour this to allow for the rebound and to accommodate for any deformation that happens. It does give off a hydrogen gas, which is a secondary chemical reaction, which would cause the models to be porous because of the elimination of the hydrogen after the material has reached its initial set. So once those 4 hours have expired, then the laboratory or you as a dental assistant can pour up this model and have pretty good confidence that those air bubbles from the hydrogen gas will be eliminated. Some manufacturers have also added palladium powder to absorb that hydrogen gas to allow you to pour the impression sooner than 4 hours, but you have to read your manufacturer's directions to see if the material that you are using does include those things. This material can be repoured and is known to be dimensionally stable for up to 2 weeks as well. Polyvinyl siloxane does have a short working time of only 2.5 to 3.5 minutes. So that is from the time it is dispensed, mixed, and inserted into the patient's mouth. That's all the time that you get. So if you're mixing this material, you have a very short amount of time to get this inserted into the mouth. It does have a set time that's pretty standard of 6 to 8 minutes. So that is from the time that it is begun to be mixed until it can be removed from the oral cavity. There's no taste, making it acceptable to patients. Patients really love that it's not going to smell, it's not going to gag them, it's not going to be unpleasant. Disadvantage is that there's poor tear resistance of this material, so the bulk accommodation needs to be kept in mind so that we have enough material to not tear upon removal. There is a 2-year shelf life if it's stored at room temperature. Refrigeration can be recommended by some products, so read the instructions once again. You can add about a minute to your working time if it's refrigerated, but remember, refrigeration is going to potentially harm the pulp of the tooth, so keep that in mind if the patient has sensitivity or we want to eliminate sensitivity. We cannot alter the base catalyst ratio to change the set reaction. We have to make sure that we're using equal amounts of this material to make sure that it's going to give us the results that are stated in the directions by not altering those ratios. Higher temperatures are definitely going to shorten your working time, so it's going to make it set faster. So if it's a hot, humid summer day, it's going to really play havoc on the amount of time that you have to work with this material. We can manipulate this material with an auto mix. So like an extrude system or the Pentamix has something of the machines that the Polyether has. Some Polyether companies have reworked their systems to have made polyvinyl siloxane because patients like that better because of the lack of odor and the better taste of the material. So to get this working, we're going to prep the tooth, isolate it, and pack it with a retraction cord if necessary. We can use a stock, custom tray, or triple tray with this material. And then remember we have to allow extra space for that bulk accommodation so it doesn't tear. We use the tray adhesive that was meant for this material only and paint it on 15 seconds before it is being used. So you can get this ready, but it has to have at least 15 seconds of dry time before we place the polyvinyl siloxane over the top of it. Attach our extrude wash or medium viscosity material into the extruder gun or the syringe tip so that it can go around the focus, and then extrude the material into the free-flowing syringe from the front to back by pulling back the barrel of the syringe. The doctor will remove the retraction cord and inject the material into the sulcus, and then we will be loading the tray with the extrude material. So this is, again, just a brand name of material to use for an example. Then we'll insert the tray over the teeth and hold it motionless for 4 minutes until it's set. And once it is set, we will remove the tray with one quick, smooth motion. We will then rinse and disinfect our impression with 2% glutaraldehyde solution for 10 minutes. Rinse it, blow it dry, and then pour it. And remember, we need to wait for that 4 hours to pour so that the hydrogen gas can be eliminated from the set material. If you're using an auto mix syringe with the mixing tip in place, leave the used mixing tip in place until the next use, which serves as a sealing device for that cartridge. It doesn't get contaminated with base and catalyst that sets at the tip, and it also keeps an air barrier there to keep it from drying out. That is all for polyvinyl siloxane, and we'll follow up shortly with a little lecture on digital impressions.